All right, let's begin this discussion now. The Rahima Moosa Mother and Child Hospital has welcomed a new CEO in Dr. Arthur Manning, and that signals a notable change in leadership. As the hospital undergoes this transition, attention is also directed to its initiatives that are aimed at enhancing governance and leadership within the institution, addressing immediate challenges and responding to the recommendations from a report by the Health Ombudsman subsequent to findings against the hospital stand as pivotal objections. To get a better sense of the plans moving forward, let's bring in the new CEO, Dr. Manning himself, who joins us now via our video link. And Dr. Manning, it's great to have you on the SABC News channel. Thanks very much indeed for making time. You are entering this institution at an incredibly interesting time, for lack of a better term, not least because of how scathing that report was from the Health Ombudsman, Professor Malekapuru Makgoba, who spoke of a number of things: incompetent leadership, neglect, crumbling infrastructure, and a lack of the most basic services at an institution that once was ahead of its league. I wonder where you'd like to begin in solving these long list of issues.
Thank you very much, Ayanda, and thank you for the opportunity. I think that there are obviously a number of areas that need to be addressed, and a lot of them have been already. On the clinical side, I must say upfront that we are performing extremely well. In fact, better than most hospitals, and certainly better than the benchmarks that have been set for us. I think the challenges at Rahima Moosa is that the amount of service that is delivered really overwhelms staff, because the overcrowding is a big issue. And this is really because there are not enough other facilities around our area. So that needs a collaborative process of planning, to reopen facilities like Discoverers, which is part of the Ombudsman report, and that is receiving the necessary attention, but also working closely with referral institutions so that we can strengthen their skill and they would refer less patients to us. We also, as part of the Ombudsman's report, which was the recommendation to be reclassified as a tertiary service, this will allow us to access grant funding, which will then give us resources to appoint more staff and get more equipment and improve the overcrowded situation on that side. The infrastructure side, the hospital is looking a lot better than at the time that the Ombudsman report was released. We have done emergency remedial work, so issues like sewage and water leaks and so forth has been largely addressed. But because the hospital is 80 years old, it does require significant infrastructure. And I think from the end of May, we'll probably look more like a construction site than a hospital. So we in the end stages of appointing contractors, we will address the replacement of a lot of our water reticulation, our hot and cold water systems. We will replace much of our sewage systems. We will replace some roofing and continue with waterproofing, flooring and painting and air handling for better infection control. So there are plans for significant infrastructure improvements to the facility. I think that the facility itself, once we've upgraded it, then the level of clinical excellence will be matched by how good the hospital looks.
Yeah, absolutely.
We also are very...
I beg your pardon. Sorry, what I was about to say was, there are many people, we understand, of course, at the institution who want to do the work, but in many instances, they've decried the lack of support in the form of infrastructure and many other resources. But what I wanted to also outline with you, Dr. Manning, if you don't mind, is just getting your sense of how we got here. It's great to hear that there are plans to turn the tide. I think that's most welcomed. But the report by the Ombudsman was spurred by reports around expected mothers, for example, sleeping on the floor, and allegations of inadequate oversight by the previous CEO, who was meant to have some kind of disciplinary proceeding, if those recommendations are anything to go by. How do you ensure that, of course, as you turn the tide, we don't get back to where we come from?
I think that the plans we have in place is part of making sure we don't get there. So part of the overcrowding and the fact that we have more patients than we have beds is a function of a few things. One is that there are not other facilities to refer them to, and that's why opening other services are important. In fact, in the next few days, the department will announce the opening of the midwife obstetric unit in Westbury, which is only half a kilometer away from us. So that's one of the steps to reduce the overcrowding in that ward that you initially discussed. And so it is in this collaboration with the Ressa Referral Center that we plan to improve the way services ran before. There are backlogs in infrastructure for various reasons, some of them just because the resources required to improve hospitals is a lot less than what is required is a lot more than what's available on an annual basis. And so sometimes areas are prioritized. If you have things like the fire at Charlotte Maxeke, then obviously you have to divert some resources as well. And so we have had to do detailed planning, and there is a detailed plan which will span 5 years to revitalize the hospital and bring it back to the state it was in before. I think that the plans are now there, the execution is starting, and the team I have will certainly guide that process to make sure that it is delivered to its completion.
Right. When you speak about backlogs, I wonder if you're able to give us a bit more details. I mean, part of what the Health Ombuds had raised concerns about was that the institution is not able to do or deliver the most basic of services. Has at least that issue being sorted at that level, or are the backlogs so, deeply entrenched that there are some basic services that you still aren't able to provide?
At the present state, we are very much on top of those services that were in backlog before. So we, for example, have programs to make sure that we caught up on pediatric surgery. We've involved partners like the Nelson Mandela Hospital to catch up on backlogs with CT scans. We have performed backlog surgery for ENT so that we have absolutely no waiting list at the moment. Patients who come in and require ENT surgery literally get it within the same month. We have caught up and reduced gynae cancer surgery from months to literally less than 6 weeks. The one area where from time to time they build up and backlogs is with cesarean sections, and that's purely a workload issue. So we would schedule an elective cesarean section, and on a day, if we have 10 or 12 or 14 emergencies, then we end up postponing those elective cases. I think it's important to mention that after Chris Hani Berra, this is the busiest unit in the country with over 16,000 deliveries a year. And that's not something that any other hospital could boast to be able to manage on a consistent basis. So the workload is significantly high, and the dedicated staff continue to do the best they can. So I would say that despite all of these challenges, we are performing extremely well, and there's absolute passion and dedication to addressing those areas where we not happy with the outcomes that we get at the moment.
Yeah. What update are you able to give us, Doc, around those disciplinary proceedings that were meant to be taken against the former CEO, Nzogo Mkabayi, who was said to be out of office for days on end? I think the figure was 180 days counted by the Health Ombuds. And part of the recommendation is that there should be a DC against her.
So I'm unable to give you any feedback on the CEO herself because obviously she doesn't report directly to me. That matter was taken up at central office. Part of it was to support her as well as to observe certain processes that had to take place. I understand that she was very cooperative and that she certainly did improve in the areas that were being monitored. But what the actual end result of those processes, I'm unfortunately unable to give you information about that.
All right, fair enough. What it does point to, though, is a culture of accountability, right? If there was anything going wrong insofar as the manpower at that hospital, it certainly started with the CEO. And whilst there's directed action against her, I wonder how concerned you are about other people who had taken on that culture, who are still at the institution and may not necessarily be able to support these renewal efforts that the institution is now embarking on?
To the credit of staff, I don't think there's anyone here right now who doesn't want to see Rahima Moosa get back to the glory days. I am certainly, the team of managers that I work with have committed to the processes that we've identified, and they've been able to deliver sometimes later than I'd like, but certainly their commitment to improve has been there. And I think that the Ombud recommendations in terms of the leadership was one of having the correct leader to set the pace, to set the strategy, to support the managers in their execution, to identify where the areas of weakness was and to support that. So I think that the hospital is on a much better footing than when the report was delivered. I certainly am quite comfortable that there is no one actively pulling back on the delivery that we need to achieve.
So outside of the CEO, has anybody else being held accountable either through a DC or some kind of action?
There was one other individual who did go through a disciplinary process, which was successfully concluded, and even that individual has performed extremely well. So there have been no direct dismissals as a result. On the organization side, there has been a lot of management development and support, and I think that area was quite critical to make sure that we had the right skill or had the right support for the skills that were available. So I think that the assessment at the time, and certainly besides my input, there was a supportive team from central office as well as from the National Department of Health. Those individuals, very skilled, along with me, made these assessments and made the call that the appropriate action was to provide the necessary support and to develop skills where that was necessary in order to get the work done.
All right. It's a much rosier picture, Doc, that you're painting, I must say, than that was painted by the likes of Dr. Tim Meyer, who could ever forget his open letter addressing some of their issues at Rahima Moosa Mother and Child Hospital. In fact, some people might say that it was that decision that kind of spurred into action the series of events that have unfolded since then. Is he still with the institution, as far as you're concerned? And I suppose a secondary question to that is, how are we ensuring that other Tamers who are still there feel comfortable enough to speak out if they do find issues with how things are being run, especially when you consider what the initial reaction against Tamer was? It was to suspend him.
Thanks very much. So Tim is very much a part of the Rahima Moosa Hospital. He's in fact one of our star performers. He's one of our subspecialists in an area of specialty called gastroenterology. And his particular service, we drain patients from every other province because of the expertise he delivers. So certainly he's one of the stars of the Rahima Moosa Hospital. It would be strange for a hospital manager not to recognize that level of excellence and to support it wherever possible. And besides him, there are many others I can name in allergy medicine, in cardiology, in neurodevelopmental medicine for pediatrics. We have a number of superb individuals, superb academics and superb clinicians. And all of them are part of our team of redeveloping Rahima Moosa Hospital. So instead of us blaming people for things that go wrong, we sit down, identify the problem, identify what needs to be done, and provide the necessary support so that we feel free to raise issues where there are still gaps. And instead of having fear for raising what's wrong, is we can raise those issues together and we can deal with them together. There is no clinician or other staff member who has to fear at all about raising an issue about even a leaking tap or an issue that concerns them. The management team is responsive and is really working alongside clinicians so that together we deliver the best care we can.
Yeah, I certainly hope so, because I shudder at the thought of what would have been of the institution had Tim not written that open letter. But Dr. Arthur Manning, thanks very much indeed for your time. All the very best with the mammoth task ahead, especially because of how many people desperately rely on the institution working. Arthur Manning is the new CEO at Rahima Moosa Mother and Child Hospital. Thanks very much indeed. We'll certainly keep watching developments around that story and many others.